Hey, Pushnet, new video. This one I want to do a new series I was mentioning this month. While I'll be working is on the laboratory and testing that we could do. And so, but before because I started to do my reading, I'm almost completed all my research and stuff. But I wanted to do an introduction because it's not a subject that I hear a lot about. People like talk on YouTube or things like that, and why is it important? And also, I think this video will be helpful if you ever had to encounter or visit at the emergency or stuff. Because my approach will be mostly through the emergency. Because if you go see your family doctor, a lot of time they won't need blood tests and stuff, and there's um, uh, because a lot of time the disease there's a little bit of different approach. Um, but this will be a little bit explaining the why and the goals and some of the reasons. Not exactly all I have right now because I'm still reading about stuff, but the reason of some of this choice I took. So when you go to a hospital or any healthcare professional, uh, when I have like students with me, I always explain to them that basically medicine is like a reverse triangle. Is that when you come, for example, with a complaint like shortness of breath or chest pain or something, there's a lot of things that could create your issue. So what we try to do is go from large to the one or two problems, and this is what in medicine it's called differential diagnostic. So basically, you got your main diagnostic, like I think this is what it is, but could be that as well. And so, because there's a doubt, and we cannot just go on down, but not that we have 100% answer all the time, we rely on some what we call diagnostic testing for that. And there's different category of that. So, the first one is the physical exam, as you can see here. And then we have also some diagnostic imaging, CT scan, X-rays, ultrasound, all basically a tech that needs to do ECGs, all that kind of stuff. And then we have a lot of time other tests like blood tests, sputum cultures, blood cultures. So a lot of things I have to relate with body fluids, basically. So anything that we can get out of you, will send for a test and things like that. So out of that category, the physical exam is about 90%. Or a good doctor or a good healthcare professional, I should say, 90% of his ideas will come from his physical exam. People that rely heavily on blood testing and stuff is because they're unsure of what to say. But basically, after questioning correctly, doing a quick exam, auscultating and looking in your ears, your eyes, or something like whatever the issue is, after you did that triangle, you should be able to say, yeah, I'm at 80%, 90% sure this what it is, but it could be that, and I want to rule that out or rule this in. There's different ways of approaching. I don't want to go too much technical about that, but each test that we do has a certain ways of either ruling in things. So that means that if you didn't suspect it, if the test comes back, now you have to do some testing to make sure that it's not that. And rule out is that if you do your test and your test comes back either negative or positive, then you can say yes, this person doesn't have that. So for example, if you send a blood test called troponin T, is a rule out diagnostic. So if the test comes back negative, we're at 95, 80, depending of the time, but the test we're pretty much 90% sure that you do not have a heart attack. So this is to rule out the diagnostic. But another blood test called a D-dimer is to rule in the disease. And so if the test comes back positive, there's a very highly chance that you have either a clot or something in. So it's, and sometimes it's used also in instances like things like aortic dissections and things like that to rule in disease. So if you don't have it, that the disease is not in, it's out. But it's most of the time to rule in disease, not rule out. So physical exam is very important. So this is why, and this is an advantage for people with self-reliance, because that means that if through like the videos that I'm trying to do and those checklists and questioning and stuff, you can pretty much be sure of what you're doing, or at least help you. So if you have like a good course like an EMT course, which is a lot of physical exam and how to ask questions, basically, because this is where the art of medicine comes. It's about asking questions, and you can see it, for example, when I go in and ask question to a patient versus a new grad that comes out and asks question to the patient, the same patient with the same issue. They'll take some time longer because they'll ask all the questions and everything. Well, I'll focus my question on more things, and pretty much will come out with almost the same thing, but in a shorter period of time, because my question were more focused and more concentrated, because I have more experience with physical exam than the new grad has. So that's why physical exam is important, and this is a good thing. Diagnostic imaging, not really a possibility in our setting, unless I'm not aware of any community that could buy a CT scan and run out on 12 volt or 24 volts. But right now, it's not a possibility, and it's not much of a big deal, because I mean, in developing country, there's a lot of places they don't have those things, and yet Doctor Without Borders and stuff can still do a lot of possibilities. So they can do 90%, 95% of their job without all that modality. In the developing, well, we came kind of accustomed to having those tools and almost becoming dependent on them. But we were doing medicine without them for a long period of time. That said, there's maybe two exceptions that I could see use in self-reliance medicine, and not so much at unless you have a big budget. But I did a video on that, this is the entitled CO2, which could give you a lot of information from the inside, monitoring patients and stuff. But I could see if you have a big community and have a little bit of money on the extra, that could be an option. Runs on AA batteries or 9 volts, I think. Anyway, it runs on batteries, so you don't need like a lot of power. Gives you a lot of information, and you could do some deducting if you know what you're doing and read the waveform, especially like this one. You can see the waveform right here, and so it could become a good viability. Also, not so much right now because they're kind of novelty, but in the next few years, as old technology, right, when they come out of the market, they are very expensive, but then they decrease in price, and as you know, they'll make their way to eBay and stuff like that. Ultrasound, especially in austere medicine, ultrasound is becoming a very big tool. So as you can see over here, it's called the Mobi Senti, and this what it is basically, this is like an iPhone or a smartphone of any sort. So yeah, any iPhone I think works, and there's an app and stuff, and then you got this little probe that you connect to your smartphone, and basically now you have a portable ultrasound. So very lightweight, doesn't consume any energy, because really all the energy you need is whatever it's on your phone. And in medicine now, in emergency medicine, basically we have a joke now, because ABC for air, burp, breathing, circulation. Well, now we say that in emergency it's ABCU, airway, breathing, circulation, ultrasound, because they jump right to the ultrasound to check everything. Even in trauma now, we have decreased a number of x-rays because of the ultrasound, because it gives them a lot of information in a very short period of time, and more studies comes out, more and more it validates what an emergency doctor can do. And as a kind of trickle from that, some system in in the United States and some place in Canada are using that in pre-hospitals. So they're giving courses to paramedic and EMT and stuff in the use of ultrasound. So they're becoming more available. As that technology becomes more available, I suspect this will go down. A machine, well, not this mine, but an ultrasound machine used to be about $20,000, $15,000, but now I think this one is in the ballpark of about 4,000 or 5,000. So that's already a big decrease. And so, like I said, as new technology kind of come out and stuff, and actually at one time I kind of look on eBay, and there was some ultrasound for a veterinary that I think was in the ballpark of about $500, $600. So I don't know exactly all the pixels and everything, but I think for a community, there could be a possibility, and then you have almost an unlimited use of those things. How to start IVs, like we're starting to start IVs with those things, because you can see veins easier. They can diagnose fractures. You can check if somebody is in pulmonary edema, if they need fluids and stuff. So there's a lot of options with that. So that would be one thing that I would kind of keep on the radar and read about for the incoming stuff. So then we're left with two or three things, and basically it's all basically fluids from our bodies. So we got bloods over here, urine, sputum, and this is mostly what I'll be concentrating my research and my things. Don't forget though that I'll make sure, but as we talk about those things, as we're playing with body fluids and stuff, PP will be very important with that, because we're talking about playing with contaminated, but possibly contaminated product, either of infectious disease and stuff. And so if you're playing with this, then you need to know a little bit. But why the reason of playing with those? Well, for example, if you have somebody, for example, in the sputum, and you have green sputum, well, it could be just a bronchitis, and basically antibiotic won't do anything about it. And but if it's in a pneumonia, then you would want to use the right antibiotic. So basically, this is why in self-reliance medicine, where supplies are limited, where your also decision, should I move, like, can I treat this person here? Bronchitis, you could. Pneumonia, well, if you have no antibiotic, or if you have some, do you have the right kind, and all that. And won't get to that talk. I did a few videos about this and my opinion on that, but maybe you need to move more towards a closer facility and get those things and stuff. So this is where it would help you take better decision about bugging in, bugging out, moving in, moving out, keeping the person with you and stuff like that. So this is where the bulk of the exams will be focused on and stuff. So anyway, that was a quick video introduction about what's coming on. Oh yeah, and one more for Stool. I'm still debating and reading a little bit more. It's kind of yes, no, because some of the tests would be easy, but would they provide more information? Because basically the goals that I have set is that it has to be easy to do by a non-medical person. Because if you need to have like 3 years of lab tech to do any evaluation of what you're seeing, then it's no use to do the test. It has to bring new info. Like for example, when I was saying, when we send people, if 90% of your tests, like for example an appendicitis, by 90% of your tests you can pretty much sure that you have an appendicitis. All the other tests is just to confirm that you're right. While in the self-reliance medicine, we could just say, well, look, I'm 90% sure, I'm not playing with this. Even if the test would confirm that I'm right, I'm still need to do something with that. So basically the test won't bring you really new info, it would just reassure you in the info you already have. Well, then focusing your energy on that is not really important. So this is why bring new info is one of the goals. Not expensive, obviously, because we all have like limited finance with all the other stuff we have to buy. Long shelf life, so that it can stays in their bags, because most of the time we won't use those things. and easy to learn and remember. So I want those two things because, for example, one of the reasons I prefer stapling versus suturing is because of that. Not that learning suturing is hard, but is that in 6 months, a year, 2 years, when you'll have to use this technique, if you didn't practice, will you be able to use it? Versus stapling, easy to learn, easy to remember. So well, that's why when I teach stuff or when I search things or I recommend things, this is always what I keep in mind. In 6 months, 1 year, is it easy that you can just pick it up and use it? Or somebody that is not trained, a lot of people don't seem to remember that, but if you're the injured person and your family has to take care of you, can you teach them on the spot how to use the gear that you have for you? So that's the goals of what I'm going to be preparing. So anyway, yeah, that was the introduction to the new series coming up, and I'll